So Angela, Editor-in-Chief of the CMI Communications, or Comms as you call it, right?
Perfect.
Yeah. So what inspired the creation of CSI Comms?
So CMI Comms was actually, I think its genesis started probably several years ago. Already then, ESCMID saw that CMI was doing very well, and that the research community was also growing. So I think ESCMID, as a society, felt that there was room for a second journal, and particularly a second journal that is fully open access.
Yeah.
As we know, CMI is a subscription model that is hybrid open access, but there is not yet a society journal that's fully open access, and that's really the role that CMI Comms has.
So what are the benefits?
So the benefits. Well, I mean, as we know, there's also, it's a very good thing. The funding bodies are really pushing us as researchers to publish in fully open access journals. They are spending a lot of money. We're spending a lot of effort to create evidence, to create data that then should go back to the world. It shouldn't be restricted. So that's the whole philosophy of the fully open access journal, so that's the direct benefit. There are plenty of other benefits too, and I can go into them if you.
Yeah,
if you
sure.
like. I think so. With the new journal, we are there very much to complement CMI. So the scope and the aims are actually very similar. Mm-hmm. It's not that this new journal will be more ID and CM or more clinical microbiology. Both journals will still be very much sort of loyal to both infectious diseases and clinical microbiology. So in terms of scope, we won't be that much different. We, as a new journal, actually may have an even broader scope in the first few years, because we want to see where the authors lead us, actually. For us right now, for me and my editors, anything that has to do with pathogens is very interesting.
Yeah.
Whether that be clinical, how you want to treat pathogens, how you want to diagnose them, how you want to prevent them. So we are very broad scope, actually.
So there are a lot of similarities, but how will CMI Comms differentiate itself from CMI, but also from other journals in the field?
So as we were saying, the scope will be similar, but a bit broader. And on another level, we will be using media a bit differently. Our website will be very interactive. It's built now already, but our next step is actually to use it to learn more about our community, our end users, our readers, our physicians. They are clinical microbiologists. We want to know what they think, how they practice, how they make their decisions. So we will be doing surveys, we will be interacting with our readers much more than I think a traditional journal can do. And then we also will be, we will have a podcast. Our podcast is monthly at first. And then we will be doing more frequent podcasts. I have a great team of editors. All of us will be at different times co-hosts. And we will be doing podcasts that certainly sort of disseminate research that we are publishing as a journal, but our mission is also education. It's the mission of our society.
So you're not only covering the papers or the publication.
Yeah, but we want to have a conversation. So we will be, podcasting about our interesting publications, but we will also, in fact, we've got the program already for this year. We will be talking with experts in the field about hot topics, new challenges in a warming world, spreading pathogens in a globalized warming world. We have experts coming on to help us, to help some of us learn to deal with tropical pathogens that we haven't seen in Europe until now, or in other more temperate climates elsewhere in the world. So the podcast will be certainly, publicity for the journal, but much more so, it will be a way to have a conversation with our community and to push it forward so that we are all learning and so that it's helpful to people.
Yeah. So how does CMI Comms support early career researchers and clinicians in publishing?
So this is a great question because this is very much part of our mission. I cannot say that this differentiates us from CMI because CMI also has this mission. CMI is doing a great job supporting early career professionals. But CMI Comms, being a younger journal, it's some of our editors, most of our editors are actually superstars. I'm very proud of them. But we have some people on our scientific committee who are early career, and we want them to have a voice. We don't need large scale in our publications. We need originality. And those early career, mid-career people, they are the ones on the front line. So they are the ones who know where the evidence is lacking. They know what studies are actually most relevant. So we want their work. So we are very much promoting them. We have one section, for example, where we will publish case reports, and they must be written by a trainee. They must be written by an early career clinician who maybe wants to do a little research, because we want them to have a voice. And this section, it's not just going to be publish your case report, write it up and be done. We want that trainee to go through a process. So they will write up the case, but they will also be working with our section editor on this. It's Emily MacDonald, who's very well known for her work on evidence base and methodology. That trainee will be writing the case report up, but also looking critically at what happened with this patient in a very honest way. Were these decisions evidence-based? Were they the right decisions?
So they actually collaborate. So the authors sort of collaborate with the editorial.
Oh yeah, there's a real accompaniment, as they say in French. I don't know if you really say that in English, but there's an accompanying process that we as editors have to do. That's our job. We get the best out of our authors.
But this is for the case reports. But if someone submits an original article on a trial or whatever, can you elaborate a bit on the process? So they submit it to your journal?
So everything goes through the editor-in-chief. It's centralized to me as a first pass, and then I will, if I may need to reject right away if it's out of scope. Or if it's just clearly unoriginal, and I don't think it's going to push the conversation forward, then it will be, unfortunately, it won't go further. However, for manuscripts that are within scope and that are original, I will then assign it to one of our associate editors who will make his or her own decision. I like to not be the only pair of eyes on and making these decisions. We will decide together whether this merits peer review or not. And then that handling editor will send it out to peer review if the decision is yes, and we will get they will have their say. Does this manuscript merit publication with us? And if they think it does, obviously they're going to do. They work hard. Our peer reviewers work very hard, as do our editors, and they are going through it really, line edits and what needs to be better reported, what needs to be fixed in this manuscript. And then they make their recommendation. Is this worthy of publication with us? Can it be fixed? And if
does the associate editor then
with
decide?
The peer reviewer?
But they decide whether they're going to go ahead with major or minor revisions, or unfortunately a rejection.
So then, so the peer reviewers have their say. The editor, the handling editor, then gets their input and then makes the editor's decision, and then it comes back through me. And what happens is we ask for a revision, and the authors usually are happy to do the revision because they've invested this much already. Absolutely. And then there can be more than one revision. We are not slave drivers. We are not workaholics by any means, but we want it to be good. So we will sometimes ask for more than one revision. It depends. It really depends how much the authors can invest.
But it's quality control for your own journal,
right? It's quality control. And it's really nice. It's a meeting of the minds between these editors and these authors. You're really discussing their work. You're finding the best way to present, to report these results in a way that they'll be useful, in a way that they'll be interpretable to people who are out there struggling, right, with lack of evidence, with not knowing where to go, not knowing how to make certain decisions.
Yeah.
So
how do you envision CMI comms contributing to advancements in the real world? So in real world clinical practice, how will that happen?
Yes, so lots of ways. Already we are publishing, for example, ECMID abstracts. We will be publishing all ECMID abstracts. That's more than 5,000. So that's already, ECMID has not been doing that. They've had a program book, but they have not published abstracts in a while. So that will already help out authors who want to really cite their work.
Yeah.
We are also publishing consensus papers, guidelines. So that's a very concrete way of playing
guidelines
an important role in our
towards real world clinical practice.
Yeah. And like I was saying, there's some very concrete ways of doing it. But I think also our role is very much having this conversation with people in our community through the interactive website, through the podcast. It's really about, our name is literally CMI Communications. It's really about having a discussion. I'm very happy to see that medicine in general is becoming much more interactive. It's not just the doctor, the expert who pronounces his or her opinion. We have a patient representative on our scientific committee. We have all actors in our field of infectious diseases and clinical microbiology. We have a lot of different roles of people who are part of this conversation, and I think that's really one of the most important things we can do as a journal in 2024, which is no longer just a bundle of papers.
Do you see CMI comms also play a role in fostering collaboration between practitioners on one hand and science on the other hand?
Yes, that's an excellent question, because that's the beauty of being both infectious diseases and clinical microbiology, because we're sort of the bridge between the two. And unfortunately, I think in our world there are a lot of microbiologists who don't get enough exposure to the clinical world, and vice versa. There are a lot of infectious disease clinicians who never go into the laboratory.
So there is a gap. But
there is a gap. There's this in-between
combined
space.
Journal with a broad scope can help bridge it.
So again, that goes to the communication and the putting these different people together and having them talk.
So what are your goals and ambitions for CMI comms in the upcoming few years?
Right.
Let's
so there are the 5-year, there are the 10-year. The near future is we're a brand new journal, so we have to have some very immediate goals. We are already working towards becoming indexed. That's part of getting that'll be done in about a year for certain indices, and in 2 years for other indices. So we have these very concrete goals with our publisher, which is Elsevier, but our goal is to create a forum for open access knowledge exchange, for exchange of ideas, and really thinking outside the box, ideas that might not be so traditional, and creating a place for conversation about these things, pushing, testing limits, and we don't, as I wrote in our inaugural editorial, we don't need scale. We don't need huge trials. That's not what we need right now. We need originality. We need early career, mid-career people who are out there in the trenches. They're the ones who have really relevant ideas for research. We need their voices. We need their work, and it might be very small scale because they're not going to have the funding, they're not going to have the backing that big researchers will have, but they have the ideas and the spark that then later we can build on. That's really what we're looking for.
So it's all about progressing the dialogue and keeping it going. Thank you so much, Angela, for explaining us a little bit more.
Thank you, Judith.